Good afternoon, and thank you for joining us today. In the process of being transparent about the number of cases and deaths, earlier this week we started to include data about probable cases based upon a national definition used by the CDC. But we realize this category can be confusing since it does change over time. So before I go over today's case count, I want to explain this a bit further. When a case is confirmed, it means that there is a positive test result for that patient for both our case counts and our death statistics. Some of the probable cases are actually still under investigation, meaning additional data is still being gathered. Some of these cases will remain a probable case after investigation, especially after someone tragically passes away, because we may never really be able to get a confirmed test. This verification process is very intensive, and under normal circumstances, it can take months to complete. We talked about the work of our epidemiologists, who are our disease investigators, sort of our disease detectives. That's who does these case investigations. But as we know, these are not normal circumstances. As we have said many times before, we continue to refine the data that we are collecting to provide everyone this information in as near time as we possibly can. This is really difficult with thousands of reports each day. We have had counties, for example, that have had to change in their case counts from one day to the next because we were able to verify that their correct county of residence was different than where they passed away and where it was reported before. And I know that that also is difficult to understand, but that's how the CDC reports cases, both for case counts and for deaths. It's their county of residence. So today, you're actually going to see a decrease in our probable cases, specifically probable deaths, and that impacts our total case count. These cases were previously reported as probable, but further review has determined that we needed more information before we could attribute them to a death related to COVID-19. This does not impact our confirmed case count. It just impacts this new probable case count. Now, I want to emphasize, to make the data-driven decisions that we are making and the governor is making, we actually rely upon the confirmed case counts. And probable cases make up less than 2% of our total cases. But they give us an idea of something may be happening in a community that requires further investigation. And in the spirit of transparency, we have wanted to report that to you, but it is complex. The really fantastic work being done by our team behind the scenes each day to reconcile this data has assisted us in continuing to provide more and more data publicly for the media and for the public. But at times, there are things we need to review and potentially revisit the way the data is being analyzed, and this is one of those times. So as of 12 a.m. today, there are 37,053 total cases of COVID-19 in Pennsylvania. This includes 36,665 confirmed cases. There are no questions about that number. And 388 probable cases. As of 12 a.m. today, there are 1,421 total COVID-19 deaths. So this is an actual decrease of 201 than was reported yesterday. And that reflects that the probable deaths have been removed from the count because of further investigation. As we work to move regions of the state, as the governor was describing last night, from red to yellow and eventually to green, we are actually looking at the confirmed counts, that confirmed data to make those decisions. To further explain, we will be looking at regions where a population-based rate, which measures the cumulative number of new confirmed cases per county over the last 14 days, using the 50,000 cases per 100,000 residents metric. So that's what the governor spoke about last night. I'm going to repeat that because it's a lot. We will be looking at regions where a population-based rate, which measures the cumulative number of new confirmed cases per county over the last 14 days, using the 50 cases per 1,000 residents metric. But this is just one metric, which will be combined with others, such as the availability of testing, the available hospital beds, the case management and contact tracing that we have discussed before, and the modeling by Carnegie Mellon University. We're putting all those together to make a final determination about reopening a region. So that was a lot about statistics and epidemiology. So we hope we got this right for you. So finally, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds. That hasn't changed. The time it still takes to sing happy birthday twice. And use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands. And try not to touch your face, especially if you've touched surfaces. Please remember to clean surfaces frequently. If you have to go out for life-sustaining activities, please wear a mask if you're going to come in contact with others. These everyday prevention measures can help slow the spread of this dangerous virus, COVID-19, and give hope to our families and our communities that we can recover and we will recover together. If you have questions about your health, please contact your healthcare provider. If you or someone you know needs mental health resources because they are experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741 or call the statewide support and referral helpline at 1-855-284-2494. Again, 1-855-284-2494. For the most reliable information related to Pennsylvania's response, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is stay calm, stay home, and stay safe. And now I'm pleased to answer questions.
Thank you, Secretary. Our first question is from CBS 3. And a New York Times article shared that by the time New York City confirmed its first case of coronavirus on March 1st, thousands of infections were already silently spreading throughout the city, a hidden explosion of a disease that may still be viewed as a remote threat as the city awaited the first signs of spring. Hidden outbreaks were also spreading among completely undetected in Boston, San Francisco, Chicago, and Seattle, long before testing showed that each city had a major problem, according to a model of the spread of the disease by researchers at Northeastern University. Can you speak of your thoughts on this and the new modeling from Northeastern University?
So I have not had the opportunity to look at the modeling from Northeast University, but our team will, and we'll analyze that. And that's a very interesting hypothesis that there were many cases before the first diagnosed cases were apparent, and so we'd be pleased to look at that and analyze it.
From WESA, will reopening be county by county or region by region? And do all counties in a particular region have to meet the threshold in order for the region to reopen?
Mm-hmm. So the opening will be region by region. And, of course, the regions are made up of counties. And as I mentioned, that metric will be very important. It's something that we can measure and put and put down on paper. But it's not the only measure that we're going to be looking at. We're going to be looking at a number of different things and variables to make our decisions. So it'll be the amount of testing we can do. It'll be the amount of contact tracing we can do from a public health perspective. And then we'll also have the modeling from Carnegie Mellon and then other variables possibly as well. So there's a whole bunch of different factors that will be going into quote-unquote reopening a region.
From WESA as well, for a region to reopen, there must be enough testing available for people with symptoms in target populations. How is enough testing defined? And will asymptomatic people in target populations be tested?
So we will not be able to test asymptomatic individuals in target populations. We still will rely upon testing symptomatic individuals. We are relaxing, however, our standards in terms of who would be tested. Previously, we were prioritizing those that were healthcare workers, those in long-term care living facilities, and then other seniors, 65 and older, all of whom had symptoms. But we're going to relax that, and we're really going to start to look at anyone who might have symptoms, and we won't be using those other stricter criteria. But we will not be able to do the widespread population-based testing of asymptomatic individuals at this time. And so we're going to be looking at a number of different ways to increase our testing capacity. We'll be looking to healthcare facilities and hospitals and health systems to be doing testing. We're going to be looking and partnering with Rite Aid and perhaps other businesses to be able to do testing. We've discussed the possibility of having a mass testing site available. We heard the possibility of mobile testing today from Senator Baker. So a number of different ways that we might be able to increase testing in the areas as we start to reopen them.
From WTAE, following CDC Director Redfield's reminder last night about the importance of getting a flu shot, we wanted to know if the Pennsylvania Department of Health is doing an early or additional preparations for the flu season that would begin in the fall.
Well, we don't have early preparations, and I don't expect that we'll have additional preparations, but we always have very robust work to prepare for flu season. I'm sure they're developing the flu vaccine as we speak, and then we will have a very robust push out of the flu vaccine and messages to get the vaccine. It'll be particularly important this year, even more important than usual, for people to get the flu vaccine so that they are strong enough to be able to deal with a possible coronavirus if they're exposed.
From WGAL, looking for clarification on this line, a county can make the list for consideration to open if they, on average, for the past 14 days, had 50 or less new cases per 100,000 residents per day. Does this mean that you add up a 14-day period and calculate the average new case number over that time? In other words, we are calculating one number that is an average of those during the last 14 days.
So just dropped my mask, excuse me. So it is, it's a little bit, I'm going to have to think about that one for a second, but I think that that's correct. And it isn't going to be counties that are isolated. So we might have a county where the rest of the region is having significant rates of COVID-19, but they might meet that criteria. We would not open that region. It's not going to be isolated county by county. It's going to be actually region by region, looking at the case rates from each county.
From WKOK, what are the numbers looking like right now under the criteria to enter the yellow phase for Union, Snyder, Northumberland, and Montour counties?
So I'm not going to look at each county and respond to that today, as the governor didn't last night. We're going to be looking at this over time. We're talking about more than a week from now, so we're going to need to actually about 2 weeks from now. So we're going to need to look at data as it's happening, and then we'll make those calculations. So I will not be commenting on specific counties at this time.
And then also WKOK is asking, why are daycare centers open but not gyms or schools?
Well, so if people are going to go back to work in those counties, then they're going to need daycare. Otherwise, they won't be able to go back to work. The schools have been closed for the rest of the school year. That's not going to change, and we're not going to open up, restaurants or other types of things because of the need for social distancing.
And then finally, WKOK is asking, many people still don't understand the principle of exponential epidemic. Can you explain that again?
Sure. Well, so previously, the virus was increasing at an exponential rate, which meant that approximately every 2 to 3 days, the number of cases were doubling. Now, at that time, it's kind of hard to remember, but we talked about 4 cases in a day and 8 cases in a day. But if it went from 8 cases to 16 cases, to 32 cases, to 64 cases, if you had 1,000 cases, then in 3 days you'd have 2,000 cases. And you can see rapidly how that would be going up at that straight line rate and could have overwhelmed our healthcare system. And in fact, some of the earliest models that we saw, particularly from FEMA, and I believe they were using a lot of data from the University of Washington model, indicated that was the rate, and they were starting to look at how many cases we would have if that continued. And I don't have the math in my head, but we could have had, instead of more than 37,000 cases, we could be having 100,000 cases if it had continued to go up in that rate. But we have, through the efforts that from everybody in Pennsylvania, through the mitigation and prevention efforts that the governor put in place, have been able to bend that curve so that it has been going up, but at a much lower rate. And that enabled our healthcare systems to, so far, and it's looking good so far, to be able to withstand the number of cases. There are still many cases, particularly in the southeast, in Philadelphia and in the suburban collar counties. There are numbers of hospitals there which are challenged, but we have been able to keep up through everyone's efforts and the fantastic work that we have done with the county and municipal health departments in that area, and also in the Northeast. But we're not out of the woods yet, and that's why the governor is taking this very moderate, progressive approach about opening up businesses in specific areas.
From the public source, how many and which counties are revising their COVID death counts downward because of duplicates?
So I don't have specific by county level. I don't have that information.
From WFMZ, a viewer asks, since nursing homes are a large percentage of COVID illnesses, would the governor consider removing those numbers from the 50 per 100,000 count for easing restrictions?
No. So it'll be all places and all residents in a certain county. And we know, however, that the long-term care living facilities, all the congregate setting facilities, including nursing homes and personal care homes and others, are our most vulnerable populations. And so we need to do everything we can to protect them. Of course, staff go in and out of those facilities, and so if there is a hot spot in a facility, theoretically a staff member could spread that, and it could impact a community. So all of that will be considered in counties.
Also from WFMZ, due to the shortage of tests, local hospitals are only testing people with symptoms who are over 65 or otherwise at heightened risk. Please map out the steps the state would take to get statistically reliable results for the 50 in 100,000 threshold.
Well, so as I've mentioned before, we want to continue to expand the amount of testing that we have available. And that, of course, will depend upon having the reagents and chemicals and resources for each part of that test. So we continue to test priority patients at our laboratory in Exton. For instance, the patients that are being tested at the Mohegan Sun Arena parking lot, all those tests are being performed at our laboratory in Exton. But also, hospitals and health systems throughout the state are doing testing. They're either performing the laboratory analysis in their labs at the hospital, or they're sending them out to commercial laboratories such as LabCorp and Quest. And so, but now, of course, we have a number of different Rite Aids that are doing testing. They're sending it out to a laboratory. And so we want to be able to expand that to be able to carefully manage the reopenings in the areas that will be identified.
From the Post-Gazette, What percentage of the total population should be tested before reopening the state is considered safe?
I don't have a specific percentage of the population, and again, we're going to be testing symptomatic individuals, but we are going to expand that beyond the age 65 and older or healthcare workers. But we're not at a point where we can do widespread population-based testing of an entire population, including asymptomatic people. We're not there yet.
From Citizens Voice, Dr. Levine has said the health department was working to get antibody tests to find out how many people have already had COVID-19. What is the status?
Well, we're still continuing to look at antibody tests. There have been a number of different comments by public health officials and a number of different articles about challenges with the antibody tests. So we have to make sure that it has that it's an accurate test, that it has good what is called sensitivity and specificity in terms of determining the antibodies. But future things really need to be learned. For example, one of the common viruses that causes colds is a coronavirus. It's not COVID-19. This is the specific coronavirus. But people, as we know, can get colds frequently, and having that immunity doesn't seem to last very long. So how effective are those antibodies in protecting an individual from getting infected? Are they completely ineffective? Are they completely effective? Probably they're going to be somewhat partially effective. And then the other issue will be how long-lived it is. So the utility of the antibody testing is not clear yet, and we're going to be doing further investigations on that.
From CNHI News, the governor's plan suggests that when a region goes into the yellow phase, the stay-at-home order is replaced by aggressive mitigation. Can you articulate what aggressive mitigation looks like?
So it's actually going to be aggressive containment. So the aggressive containment strategy, when a region goes from red to yellow, will mean doing exactly what I've been describing. It'll be watching for symptomatic individuals, doing aggressive testing of those symptomatic individuals. If a person is positive, they are isolated. We do extensive contact tracing of their personal contacts or professional contacts. Those people are quarantine, and we watch for symptoms. So that goes back to the containment strategy that we started with, I don't know, maybe 7 weeks ago, as the governor said, and that's what will be in place as we go to turn a region from red to yellow.
From WPVI, under the governor's plan of 50 new positive cases per 100,000 residents for 14 days, when do we project Philadelphia County and the surrounding areas will get there, or are we there already?
We are not there already for the Southeast. Philadelphia and the Collier counties are where we're seeing the most cases of COVID-19 and the highest rate of new cases. And so I can't predict when that time will be. As the governor said yesterday, and as Dr. Fauci says, the virus determines the timeline. We don't determine the timeline. But we will get there, but we don't know when.
And then also WPVI is asking, can you address whether kids' camps and kids' summer sports will reopen under the yellow guidelines, or do these recreations fall under gyms?
We have not made that determination yet.
From PA Post, can you clarify the details of the metric of an average 50 per 100 people over 14 days? As a hypothetical, if a county had exactly 100,000 people, if the county reported 49 new cases over the course of 14 days, would it meet that benchmark for being considered to move to yellow?
So it's hard for me to comment on whether it was 49 or 50, whether we would consider it. And again, it's not just one county. It's going to be the region. And again, that metric is not the only thing we're looking at. We're looking at many different metrics. And so all of that together will be taken into consideration about a region going from red to yellow.
From WTAE, in Beaver County, there have been many reports of cases at the Brighton Rehab Nursing Facility. How might the situation at Brighton factor into Beaver County's ability to reopen?
Well, as I was alluding to before, if there is a long-term care living facility or a number of facilities which are having a large number of cases, those cases would be included in the analysis.
Also from WTAE, when the stay-at-home order ends on May 8th, Are we allowed to visit family and friends again as long as it's not a large gathering? And if so, should we wear masks?
So in the areas that go from red to yellow, the answer would be yes. But we do recommend social distancing as much as possible. And we would recommend the wearing of masks. I really think that since my mask protects you and your mask protects me, that as much as possible we're going to want people who are leaving their home to wear masks, and that will be part of the efforts to prevent the spread of COVID-19 from starting to reoccur in those yellow areas.
From the Post-Gazette, how will contact tracing be done and how will it be funded?
So we have a plan that we're finalizing about how contact tracing will be done. A lot of the work will be done by our absolutely fantastic public health nurses in our county and state health department centers, as well as working with the county municipal health departments in those specific areas. But we're also going to be using volunteers. We're going to be working with hospitals and health systems that area. So we have a whole strategy that we're finishing up and would be pleased to release that when it's ready.
From the Tribune Review, can you explain what appears to be consistent issues and hiccups in reporting death data? Allegheny County officials subtracted 5 deaths today, indicating there were duplicate reports in the state system that's used for reporting. Additionally, the state listed 3 fewer deaths today in Westmoreland County, where state numbers had for weeks been behind what the county coroner was reporting. Why is this happening, and how can you assure residents that they can have confidence in these numbers when they keep shifting?
Well, I think I outlined that at the beginning of my talk. We're really trying to be very transparent. That's why we've added the probable cases and the probable deaths. That is a CDC standard. But, you know, in a global pandemic where we're having thousands of cases, it is really, really difficult. I don't know some of the specifics about those specific counties, but we do know that there are a number of different reasons why cases have, the case numbers and the specifics have ebbed and flowed. Sometimes, as I mentioned, it's been that we realized that a patient was a resident of a different county. That's how the CDC counts it. It's the county of residence. But we also, as we talked about, with further investigation, have taken some cases off the probable roll. So I know it doesn't always seem like it, but we really, really are trying to be very transparent and very open about the data. That has added to the complexity, and that's what I was at least trying to explain before.
From WTAE, has it been decided precisely which counties will be grouped by region for making reopening decisions, and is that list available? So
you know, we're working on all of that as we speak, but we're not there until the 8th.
From the Tribune Review, you've been providing numbers regarding ventilator availability across the state. Where does Pennsylvania stand on dialysis machines? More and more people are experiencing kidney failure as a result of the virus, and some cities say their hospitals are scrambling to meet that need.
I have heard that there's challenges with dialysis machines. I don't have granular data at this point, but we will be looking for that and be able to give it to you in the future.
From News Talk 104.1, with coroners on the front line of this pandemic, why are you waiting until next week to hold a call with them, as you stated in the Senate hearing earlier today?
Well, we want to make sure that we understand the different nuances of this problem. So I'll be making some individual outreaches, but we're going to wait till next week to be able to have more of a conference call.
From Spotlight PA, it appears the number of tests being conducted daily has fallen. Is that because there's less of a need for testing or less of a supply?
I'll have to look exactly in terms of our numbers. I know that it had fallen over the Easter holiday and over Passover and Easter. I'll have to look exactly where it stands. But the need for testing has not gone down. I think that that's one of the reasons why we're loosening the criteria for testing, to try to make sure that we can do as much testing as possible.
And Secretary, our last question today is from News Talk 104.1. Are suicides related to the stress of COVID-19 being reported as COVID-19 deaths?
No. So if someone tragically takes their own life because of the stress associated with the global pandemic, but they do not have COVID-19, they don't live with someone who had COVID-19, and they had no symptoms of COVID-19, they would not be considered a COVID-19 death.
Thank you, Secretary. That concludes our briefing for today. For reporters whose questions we were not able to get to, we will respond within 24 hours from the Department of Health Press Office, and we will bring you another briefing again tomorrow. Thank you.